Hello, good evening everyone. Am I audible? Please give a quick thumbs up in the chat box if I'm audible to everyone. Okay, thank you, Dr. Aisha. So let's begin. This is a short introductory session to the 5-month course that we are providing for MRCOG Part 2. Today, I'll just brief you about what we are offering and how the course will be done over the period of 5 months. And what are the various resources that we use, what are the guidelines, what are the different modules that are needed to be studied for part 2. Also, we will be talking about how a particular guide, like I will give you a brief idea about how guidelines or talk articles have to be read, and also a quick review, a quick brief about how our site is functional and how you all can operate it once you all register with us. Okay, so let's begin. So first of all, it is important to understand that for MRCOG Part 2, we have a vast curriculum to cover. It is not like Part 1, wherein we have just the 7 subjects that we need to learn and revise. Here, not only the modules are more in number, but also the number of the sources that we get to read, the materials that we have to read is also very vast and varied. And this, for example, for some topics we will have to read the green top guidelines, whereas on the other hand, for some we might have to read the nice guidelines. In similar way, the British have their own organizations like bash for infectious diseases, sexually transmitted diseases, FSRH for contraception, embraces about the maternal mortality. They also have, apart from papers or review articles in the journal The Obstetrician and Gynecologist, they also have something called a scientific impact papers. So this is something that we also need to at least have a brief idea about. The European guidelines, the FIGO guidelines for oncology, the BCGS oncology guidelines are something also that we'll have to know. So as you'll see, we should not enter this curriculum with a messed up mind. We have to understand that for which topic, which guideline we have to read. And for this, helping us understand this and to sort this vast portion for you all in an easy way, we have come up with this course and we have divided it in such a way that for you all to study a particular module will be easy. So by entering into our program, we will help you enter it with a relaxed mind. We will have interactive learning sessions, group study wherein we will be discussing the single best answer questions as well as the extended matching questions. We will be providing them with a mini schedule. So the mini schedule will be something that will, under a particular topic, under a particular module, we have broken down the different guidelines for you all to read. If it is not possible for you all to read it every day, at least you all will have an idea that this is something that has to be done to complete this module. We will obviously help you all with any stress that you all feel, any doubts that you all have. We will help with resource management. And as I mentioned earlier, we have broken down the curriculum in such a way that it is easy to learn and easy to revise. We have a good panel of mentors, with including mentors who are senior and have a good experience and have been in this field for a very long time. We have also put forth study plans and timetables for you all to revise and learn through our robust notes that we'll be providing on our website, which are not only detailed but they will also help you to understand the guidelines that are given in a simple language, and also we will be helping you to understand the exam psyche by regular self-assessment, as at the end of each module we will have a small mock. As we had mentioned earlier in one of our previous sessions, the exam structure is basically, first of all, it is clear that it is a computer-based exam, wherein the whole thing is solved on a personal computer. There are two papers. There's a paper 1 and paper 2, and each paper is divided into 50% of the total mark. 40% single best answers are present and 60% extended matching questions are there in the exam, thus highlighting the fact that extended matching questions have a higher weightage. But that does not mean that we do not pay equal attention to single best answers, because SBAs are something that will help you pass because they are scoring. The exam structure, continuing further, the paper is divided into paper 1 and paper 2. Each paper has a duration of 3 hours, that is 180 minutes. There are 50 SBAs and 50 EMQs. Now, this is not something like how we had in undergraduate where paper 1 is just obstetrics and paper 2 is just gynecology. Here, paper 1 could also be, like, for example, if they're giving you obstetrics single best answers, they could give you gynecology extended matching questions in paper 1, and vice versa. That is gynecology single best answers in paper 2 and obstetrics EMQs in paper 2. So this is something that the way they want to mix and divide. So this is not purely paper 1 as obstetrics or paper 2 as gynecology. It is a mixed paper. Time management, a tip that we can give here is that we should, whenever you all will be giving the big mocks, you'll have to make sure that 70 minutes you're giving for the SBAs, that is 35 minutes, or let's say 40 minutes in each section for SBAs and 110 minutes for EMQs. Why so much of time has been allotted to extended matching questions is based on the fact that not only is the STEM big, but the options that they give you 10 options together. So to read them and to eliminate and to deduce the right answer will require time. Thus, 110 minutes are given to EMQs. This is just a guideline. This can just vary person to person depending upon everybody's speed. But this is just a rough structure so that you all can, try managing time better, because trust me, you will need those 3 hours. This is not like part one where you will finish the paper early and you will get time to, go through the whole thing. All of 300, all of the 180 minutes in the first paper and the second paper will be utilized till the end, because that is the amount of, that is the amount of content that you have to read, understand, and answer. Now, what are the modules that we will be covering, and what are the modules that are basically included in the exam? Clinical skills with is the first one. Teaching, appraisal, and assessment is something that is different from part one. This is something new, and this is again something completely new for us, because as obstetricians and gynecologists, we have not read about this in our curriculum, in our post graduation days. So this is something that is completely new, and we need to read this. There is clinical governance and research. Research is something that we have tackled in part one as well, and this is where we will also revise it. Ethics and legal issues is also important. Consent advisors are important. Core surgical skills, post-operative care, surgical procedures, antenatal care. Now, antenatal care, for the ease of understanding, we have split it into, infections in pregnancy, maternal medicine, intrapartum management, that is management of labor, and management of delivery. Postpartum problems, like if there's a tear, if there are infections, sepsis can be included in postpartum problems. Gynecological problems, like abnormal uterine bleeding, heavy menstrual bleeding, there are really good, nice guidelines on that, and many more that we will be included in this. Subfertility, sexual and reproductive health, wherein the FSRH guidelines come in. Early pregnancy care, talking about more of ectopic pregnancies, recurrent miscarriage, abortion care is what early pregnancy care will entail. Gynecological oncology is something, again, we have the endometrial cancer, the ovarian cancer, cervical cancer, vulval cancer, and vaginal cancer. They also have the dermatosis, like the skin disorders of the vulva is another important, it's a BASH guideline, because they tend to be precancerous lesions like lichen sclerosis, lichen planus. We'll have to read about that as well. And last but not the least, urogynecology and pelvic floor problems, including, prolapses, wall prolapse. Then there could be pelvic muscle floor training. All of this will be included in urogynecology modules. Now, to cover these modules, we will be taking help from different resources. And what would these resources be? First of all, as I told you all, the reviews that are given in the journal, The Obstetrician and Gynecologist, the Green Top guidelines, NICE guidelines, consent advices, BASH guidelines, the FSRH guidelines, scientific impact papers, clinical governance advice summaries, the ESHA guidelines, which is the European Association, FIGO and BCGS online oncology summaries, and biostatistics and clinical governance guidelines. Now, these are the same things that we will have to focus on. Okay, these guidelines will be like our, go-to book for. So this is not exactly a book; it's basically different resources, and that is what we will compile together. We urge you to make your own notes, but you worry not, because we also are going to provide you with very good, concise and robust notes, which will be easy, with easy English and easy for you all to understand and revise. But again, we will also be doing the live sessions, which will be interactive live sessions. And herein, we all urge you to make your own notes, because when we have our own written stuff, it is very easy to revise. Also, with all of these, we will be giving you, flashcards and tabulated information, because again, it is very good for visual memory, also for you all to revise again. What are the clinical areas that are tested in this exam? First is clinical skills. Obviously, there will be clinical surgical skills that they will test. Post-operative care, core surgical skills like basics, like what are the suture materials used, what is ERAS, post-operative care, fluid management, ethics and legal issues regarding consent, IT, clinical governance and research. They'll teaching, appraisal and assessment, because teaching is a very important part of the curriculum in the United Kingdom, and they would want you to learn this, and thus the questions are asked about teaching and appraisal. The obstetrics and gynecology topics, which we need to learn again, antenatal care, maternal medicine. Now, maternal medicine is something which is very vast, which will include high yield topics like hypertension, diabetes, mm, and then epilepsy. The infections in pregnancy is something that we have given a separate module, because you all can learn it in a concise way and revise it in a concise way. Then we will also include the different talks which will be in maternal medicines, the venous thromboembolism, which is another important point and another important guideline that has to be read in maternal medicine. So don't worry, it's a vast module, but we have made it in such a way that it will be easy for you all to understand. Management of labor and delivery, postpartum problems, gynecological problems, and subfertility. Again, I'm not going to stress much on this, because I've already introduced you all to these different areas. And what important for us to understand is that our study approach is going to be simple and clean. We are broken down the curriculum into manageable sections. The high yielding guidelines are given in a very good, concise form. What This is something that I will time and again, emphasize on, would be revision and consistency is the key. It doesn't matter if you have 3 months in hands, 5 months in hands, or 1 year in hand. You have to wake up every day, do your work, go to college, or go to work, go to your clinic. But at the end of the day, you have to have your notes, or at least, on the website, if you can open, you have to read something every day, solve MCQs every day, because every day is the key. Consistency is the key to pass this exam. Not only understanding the guidelines. Yes, if I understand the guideline today, maybe after 1 month I will not remember the guideline, because maybe perhaps we do not use it in our clinical practice. Thus, here what is important, not only understanding it, absorbing the guideline is important, but also revising it and re-looking at it. More than revising, I would say re-look is also equally important. Thus, we will keep on encouraging consistent revision of all the topics that we will be doing and discussing. Again, group discussions and case-based learning will be there. You have to understand that part one tested you on your basics. Okay, they just saw if you were good enough in your basics, and it passed you because you were good enough. Here, they're going to look at you as a clinician. They will see how you will be able to manage the patients, because every question you read in that exam is not like a question. It's like you are treating a patient while you are answering that exam. So it is not only important that you absorb and understand this guideline, but you have to train your brain in such a way that you will be able to apply this guideline, because this is what the RCOG is trying to test and teach us. That yes, we have given you the guidelines, we have given you the ABCD, but you able to understand what the patient is and apply those same guidelines and give them the proper management, is what they're trying to teach you and test you on. So during this course, we will be giving, we have been, we have assigned modules to mentors according to their strengths, and they will guide you throughout the sessions, and also on, the case discussions and the question discussions, the mentors will be there. And another important thing while preparing for this exam would be stress, because that keeps on coming into our head, where, if you're a clinician for the past 10 years, or if you're just becoming, you've just cleared your post graduation, or you're in your post graduation and you're studying for this exam, stress is something that will come, because this is something new. This is not something that we have done in the past before. Thus we would be stressed, but you don't need to worry about this, because we will help you, you know with the stress as well. Mock exams and assessment is something that we offer, because at the end of each module we are giving you one small mock, so that what happens is, how well you are prepared with this module, and that the second time you read this module, which are the points you're lacking in, and you can revise it again. Now another important thing is, now for example, if you've answered a question on, we've just recently we've taught you all about, let's say, malaria and pregnancy, and you'll realize, well, the questions that you're answering are wrong. Okay, so that doesn't mean you sit on it. That means at that moment when you realize, okay, I have not answered this correctly, I will go back to my notes and I will open it. I will give 15 minutes of my time right now and go through the whole guideline and read the whole guideline. So that not only will you learn something that you've gone wrong, but you will also take in another added point, or something that you might have missed in the first go. So this is what I call relook, because you're looking at that guideline again. So that is what is active learning, because what we will be, there's passive learning and active learning. Active learning is when you solve the multiple choice questions, and then when you understand that this is wrong, you actively go back, relook at your guidelines, your notes, and then understand the guideline all over again in a new light. I hope I'm clear with what I'm trying to explain, and the whole concept of revision and relooking at what you have written down or what you have learned. Our online platform that we'll be providing is easy to understand, and we will be giving you module wise, curriculum, as well as the question banks, and there will also be progress tracking to identify the weak areas, as I said, uh, depending on the mocks that we'll be giving you. Now, we would, like, this is the example of the first module that we will be beginning on 19th of August, which is infections in pregnancy. Here we will have a live lecture on infections in pregnancy. And further, we have just given you a guideline on how the GTGs and the talks can be read each day. You all can do something, it is not necessary that you all follow this to a T. But one thing that is important you all have to understand is, if on 21st August we have given you time to read the chickenpox guideline and the Zika virus guideline, we will be also discussing questions on our Telegram group of the same GTGs and talks. Thus, you all will not only read it on your own, but also answer those questions and actively learn when these sessions are happening. And 27th August is something that we will give you one day for self-study. That is, before every live lecture, we will have a self-study. What do you say? We will have a self-study day off for you all, so that you'll also get a break in the middle. Now, I'm just going to quickly run you all through how what do you say, our website works. The website here, this is just a screenshot. Once you go to the medinstitutors.com, you will see this, wherein you'll have to go to login, and in logging in you can just remember me and sign in. On signing in, you will understand what are the premium courses you have. If I have the I will have to go to the MRCOG part 2 premium course material, start course, and then click it. Once you click it, I'm so sorry, just give me a moment. Once you click it, you will come to this page, where you can see at the top there is something called as curriculum, right? So once you press on that curriculum, you will be getting a drop down menu like this, wherein we will be uploading the live sessions as and when they happen. We will be including the module wise revisions, and also we will be giving you nice summaries, GTG summaries, in a short manner, so that you all can revise it, and also the talk summaries. don't worry, they will be divided according to modules as well, but this is wherein you can all find it together. We have the BAS summaries, the FSRS summaries, and also as the time goes by, the subject wise mocks will be uploaded. And also we will be keep on adding the flashcards in this session, in this subheading. So under this one drop down menu, you have all your data at your hand. And of course, we've also given you the PDF of books which are available. Now, this is something I'm not. So, when I was preparing for my part two, nobody taught us how to read a particular guideline. Okay. There is no set way of reading it in a particular way, but I'm just going to put forth um, this, this maybe I can just say a tip, a particular tip on how to read this green top guidelines. Because to be honest, when you look at them, they are like 12 pages or 20 pages, and you get boggled as how you're supposed to read it. So as you can see, I have highlighted the guideline on the management of third degree and fourth degree perineal tears. And this is green top guideline 29. Now, moving on to the page where there is something called as the executive summary of of the guideline. Now, what you have to understand is that this is a quick read. This is for a quick revision because the gist of the whole guideline is what they have given at the top. Okay. Now, how is this guideline? This guideline is basically like a chapter, but they have asked questions. They will ask questions and they answer those questions themselves. So this is basically like a question answer format. Okay, this is the executive summary or the quick summary that you all can read at the beginning. Now, as we scroll below, we can see that there are some important points that you want to highlight. Now, example, I have a habit of highlighting whatever I feel is important. I highlight it or I take a note of it down somewhere and write it in the, I can you can make it on pen or paper or you can make it on your iPad, depending on you. Now, this is where the whole detailed guideline begins. Okay. This is purpose and scope. That is something not important. Again, how they've basically, this is about the review, how they've uh, written the whole guideline. What is important for us is to the introduction and again answering of the questions. They are the same questions how they have questioned in the executive summary, but here they will give it in more detail. That's the only thing that is important. Now I have been highlighting this evidence levels, D, what is this tick mark. Now when I first began reading it, I was always wondering, what is this? What am I supposed to do with this? How is it going to be helpful for you, helpful for me? Now, this is basically evidence-based medicine, and evidence-based medicine has helped them write this guideline. Thus, by giving this, they are telling you what is the level of evidence that they are providing us. Okay. So just give me a moment, let the videos end, and at the end, I will discuss what it is, the D, the C, the tick marks, the plus plus, evidence levels. Okay, don't worry about this. This is very easy. This is not something that they're going to question you on. Okay, this is not something they'll question you on. This is the matter that they'll question you on. Um, just give me a moment, please. It's just, again, important question. You mark it, you note it. The whole guideline, they will quote studies, they will quote figures, but that is not what is important. What is the inference of all of these studies? Because there are a lot of meta-analysis that happen. And what is the inference of these meta-analysis is what they have included in the guideline. Or what is the best clinical practice that is they have included. Also, there are numbers that are given. So when we give our notes, we will also give you the percentages, the incidence, the prevalence. But if you want to read the guideline on your own, you can also highlight it and make a note on your own. These are references. We don't need to pay attention to this. And these are the, the 1 plus plus, the A, the B, the C, the D. They're levels of evidence or grades of recommendation. This is something you can just go through because they can ask you this in the research module. And the tick mark just means good practice point, wherein the team which is making the guideline has come to this with their own clinical expertise. Okay. I hope this is clear now. I'm just going to give you all a minute to, if just to ask me any questions regarding this particular way of reading the guideline. If you'll have any doubts, quickly type it in so that I can answer it now itself. Because then I will be moving on to how you can read through a TOG. Which chart, Iram? The one which I'm showing on the slide. So this is something, it's not, yes. So it's basically classification of evidence levels. 1 plus plus means it's a high quality meta-analysis. Systemic reviews are present in a standardized, controlled, randomized controlled trials. So this is all from our research. This is not important. So when you're reading a guideline, it is not important that you have to remember, oh, this evidence is 1 plus plus or not. It is just something for clinical practice. Whereas this table can be important in a research module because they can ask you what is the grade A of evidence, or if there are, a single best answer can come on this. If there are multiple, if there is a single randomized control trial, what level of evidence will it be? Dr. Ruby, ma'am, do we make notes of the guidelines? So, Dr. Ruby, we will be providing you with concise notes. But when we are teaching you, every mentor is teaching you in the live lectures. It is important for you all to. So there are, everybody has a different way of studying. Like I'm someone who makes my own notes, whereas there could be people who would just prefer, just jotting it down somewhere. Or if you have an iPad, you can just make notes in your iPad. Some people want to write it down with a pen and paper. It is up to them completely. But I would urge you all to make your own notes, not maybe from these guidelines. You can read our notes for that, but during the live lecture especially, you can, make your own notes. So going through the executive summary alone is sufficient. So to be honest, it is sufficient. But if you are someone who has time in hand, you have enough time in a day to read it, I would urge you all to read the guideline. Just go through it once. We will be teaching you the guideline. We will be teaching you what is important in the guideline, what is needed for you to answer the questions or solve the MCQs, solve the EMQs. But for your, you know, I used to get a summary of the guideline, but I used to still go back and read because I did not feel satisfied that, okay, maybe I just want to look at it. Because there are tables and flowcharts in guideline which are also very important. You get it? These flowcharts, and they are all available free on the RCOG website. So once you look at these flowcharts in the guideline itself, you can develop a robust memory, which is visual memory. Also, you have to understand that we will be providing with flashcards with tables made on our own, tables which will help you remember. But also looking at a guideline would be easy for you all. I won't say that you have to sit and read the whole guideline and waste your time. What I would suggest is you read our notes, attend the lectures, and if you feel like it, go through, skim through the guideline. Because why? If you are going with a blank mind and reading it for the first time, it will take you maybe an hour to read one guideline. But imagine if you're reading the summary or if you're attending the live lecture, you're already sensitized to the information given in the guideline, and your eyes will automatically look at the words that are important, highlight them, and just revise your, it will be a quick revision for you all to read the guidelines. Is reading the recommendations in the start not enough? Do we need to read the details of it? Because mostly it includes, yes, Dr. Myra, you're really right. But it mainly includes studies. So that's what I'm trying to tell you. When you read our concise notes and listen to the live lectures, your brain is automatically trained to take up high yielding information from the guideline. Okay. Moving ahead. Okay. So just give me a moment, guys. This is how a short video on how you can, read the talk guidelines. I'm so sorry. This is, I think, yeah, you all can see now. So this is basically the talk on liver masses in pregnancy, wherein, there is again an abstract which is given in the start. All of these are review articles. So these are basically like chapters, and they are small, small chapters with, information given in a concise way. Here there's an introduction. Then they have highlighted what are the different investigations that are there, what are the different, uh, what do you say, uh, for which form of liver masses, what form of investigations are needed. Again, you can highlight it and make your own small annotations while you're reading the article. Again, so this is a habit that I've picked up over the years. Whenever I go through something, whenever I read it, I just make quick notes. Here again, there are tables which are, high yielding. So all tables in all GTGs, NICE guidelines or talks are important, and you all should go through these tables. We will be obviously providing them in our notes, but they are also given in the original paper as well. Now, this is a lengthy paper. As you can see, it will take time for us to for you to read in the first go. But if you've already studied it in the live lecture and read it in the concise notes, and then quickly, if you want to skim through it, you can go through it. It is not necessary. Maybe I would urge you all to go through the green top guidelines, but we will be providing you good notes on the talk summaries. Always mark the important numbers, words, investigations, and make small notes so that you all can just revise it quickly. Again, references and something is which is not needed. You can just end it with the conclusion and that's it. Don't waste your time in reading it further. Now, this is an example of how to prepare a module. Okay. Here there is this is a module of obstetric emergencies, and this is how we will be providing you the summaries. We will give you green top guidelines, wherein there are guidelines on antepartum hemorrhage, placenta previa and placenta accreta, vasa previa, cord prolapse, shoulder dystocia, postpartum hemorrhage, blood transfusions, maternal collapse in pregnancy. This will be provided to you in the form of notes, but also will be taught to you all in the live lectures. And talk summary on perimortem cesarean sections. Some modules will include BAS summaries, FSRS summaries, scientific impact papers, miscellaneous guidelines. This will again be provided to you in a very systematic manner. So, what is important for preparing this exam is that you have to stay motivated and focused. You have to take each day as it comes, and you have to have a plan when you wake up in the mind that I will be reading this today, and at the end of the day, I want to solve these questions and relook at what I have maybe read yesterday. Make a timetable for each week. We will be providing your timetable. If you don't want to follow it, you can make your own timetable. Um, what is important that we have set a long term goal of taking this exam, but it is equally important to win on the daily objectives and cover your daily agenda, what is set in your mind. Acknowledge small wins, but don't get disheartened if your questions are going wrong, because take it as a challenge instead of getting disheartened. You can look at these questions, go back to the summaries, go back to your notes, re-look at them, revise them, and again solve these questions. And also, it is important that you stay connected to your peers and stay connected to your mentors. Now, what one thing you have to understand that you can, yes, maybe have a study partner, but it is not crucial to have a study partner, because you have to understand that your speed of learning a particular guideline, your speed of understanding a particular guideline, maybe you come from an institute where they've already taught you a little bit about this guideline. How would you, so this is something that is important, then it would be to not necessarily to focus that I need a study partner, I have to find a study partner. It is necessary to set your own space, own pace, and read and learn each day. Also, it is very important to remember that you are not alone. You have to believe in yourself, focus on learning each day. As I said, revision and relooking at your notes is the key, and consistency is icing on the cake. You have to remember that this big ocean is your MRCOG curriculum. Sometimes there are going to be waves and tides coming in because some summaries might be difficult, some guidelines could be difficult. But you have to remember that this boat is you traveling to the vast curriculum of this part 2 exam. And here we are going to be with you traveling throughout this journey and helping you learn each day and collecting whatever pearls of wisdom are important every day together, so that you are not only we're going to learn together and become better at our knowledge together. Before I end, I would like to highlight what are the books that you all can use. These will also be available on the website. There are, get through. SBAs and EMQs for part 2, 500, 550 MCQs, EMQs, SAQs. Again, all of these are available. You can look at them online. We will also be providing you MCQs in the question bank, so you don't need to worry about it. And we are providing you for July 2025 the premium course, which will be of 8 months. And for Jan 2025, we will also be providing you a premium long course. For any more, before I end, I would also invite Dr. Zaveria, who is our senior mentor, to please share her opinion and her wisdom with all of us who are learning each day and preparing for this exam.
Hello, good day to all of the candidates and very warm welcome. And thank you so much, Dr. Madhura. You have explained really well, and I think they all will get benefited from your guidance. There are only few things I would like to share from my experience. One of them is that, when you are preparing your part 2 exam, don't prepare it just like that you are only going to give part 2 exam and then there will not be a part 3 exam. The things which you are going to read now will help you in part 3 also. Part 3 is part 2 and part 3 are basically your management skills and your knowledge based exam. In part 2, the aim is that they test your knowledge through EMQs and SPS, and in part 3 they again test your knowledge but as a clinician sitting face to face with them. So it's actually the same thing, but the presentation of part 2 and part 3 is different. So that's why I always emphasize that once you're preparing for your part 2, prepare it fully so that when you're going to part 3, it is a very easy, journey for you. And also, if you allow me, I want to share something, my screen with you, and I want to show you some guidelines. Can I do that? Minal, can you allow me to share my screen? Hello?
Yeah, ma'am.
Can you please allow me? I want to share something. Okay, till you allow me, I'll speak about these summaries and their guidelines. Please, my dear candidates, remember one thing, that summaries are not the replacement of guidelines. At least for once, you have to read your guideline from end to end. Don't think that you can only read summaries and pass the exam. Of course, summaries are very are going to help you. I can't hear. Hello? Sadia, I can't hear you.
I'm your promotional.
Okay. So I'll show you something so that when you're reading guidelines, you know what to focus and where to focus. For example, this is your guideline, your opening guideline, for example, GTG on chickenpox, okay? So if you're So this is a GTG on chickenpox, okay? So what is important, this guideline is you say it's 17 pages long. Once you read it, then you don't have to read it again and again, all of the guideline. What you need to do is that once you have given a thorough read, your first read, uh, what you need to take out of this guideline is this algorithm. It's a must read. You should know that which guideline has which algorithms, and just take out their either printouts or make a separate folder for your algorithms, so that you keep on revising them again and again and again. The RCOG has put a lot of effort in making these algorithms, and they are a very good, like, snapshot of the whole guideline. So whenever you are reading a guideline, take out these um, algorithms and flowcharts, either in the form of printouts or in the form of like, in your folders. Make a folder on your iPad. Make, if you're using your computers, then make a folder for each module, and keep putting these important things in your guidelines. Also, one more thing is, which I used to do, is that in the start of every guideline, they are executive summaries. Okay, so these executive summaries are for 2-3 pages. They are like, before the real guidelines start. The guideline, for example, is starting from page 5, so these first 3 pages are the executive summaries. What I used to do is that I used to take out the printout of these um, executive summaries, and the other side of the page, which is blank, I used to write my notes on those pages. And then, instead of like 17 pages guideline, I will have only 3 pages of guidelines with these executive summary, and on 2 pages or 3 pages and one algorithm. So this is also one way of concising your guidelines. Similarly, this is for GTGs. Okay, and as Dr. Madhura explained, and I will share that again, the things which are written in the end of the guidelines, like, here D take, they, what does they mean? That whatever you're when you're reading it, please pay attention that what is written in the end, and then compare it here in the end. What does it mean? That, for example, D means that evidence level is 3 or 4. That means that it is recommended, but the evidence is not that much strong. Okay, and if something is written 1++, that means that is it is evident from a very high quality meta-analysis, and a lot of research, and a lot of, like, evidence is available for that. And similarly, when you're reading a guideline, please pay attention to what the word they are using. It's we are not acclimatized to the language of RCOG in the beginning, so you have to make yourself acclimatized with that language. Sometimes they use the word consider, sometimes they use the word offer, sometimes they use the word discuss. So it all means different thing. When they've written that offer something, it means that, for example, I think here in this guideline also they've written this. Wait 1 minute, I'll just show you that. See, here it's written, oral acyclovir should be prescribed for the pregnant women with chickenpox if they present within 24 hours of the onset of the rash, and if they are 20 weeks of gestation or beyond. And use of acyclovir before 20 weeks should also be considered. So can you see the difference in the language? It is considered, and here it is prescribed. Similarly, if they are sure about something, they will say offer this to the woman, recommend this to the woman. But if they are like, okay, you can discuss with the patient, you can offer her, or she can decide on her part, then they will use the word discuss. So you have to pay attention to these words, because when the MCQs and EMQs especially are coming, they are playing with these words. They will write, you will think that, oh, okay, I choose the right answer, but you will not pay attention that whether it was offer word or it was consider word. So they're actually checking your knowledge, and they're also checking your intelligence, that how smart you are, that you pick these things also. Similarly, with NICE, this is for the GTG. Please remember, in RCOG curriculum, it is not it's not an exam which check your knowledge of other colleges. Like, for example, if you have read something and you practice something which is recommendation by American College, and you apply it on the Royal College, and they don't match with each other, and you think that, no, I've been practicing it for so long, and I know that this is very good thing to do. But if RCOG is not recommending it, they will mark it wrong. So please, please, for preparation of this exam, delete all the American guidelines or your local guidelines from your mind for some time till you pass this exam.
Okay, so this is also very important. Similarly, I want to share you with the NICE guidelines. For example, NICE guideline on subfertility. Okay, it's a very long guideline. NICE guidelines are usually long guidelines, but I want to show you something that here, if you go and download this guideline, you will see. 1 minute. You will see it is like 55 pages guideline. Okay, but if you go here in the evidence and go here full guideline, then you will see that it's actually 562 pages guideline. So what is advantage of this? That although it is a 562 guideline and it's impossible for any candidates to go through it end to end, and even if it's very impossible to remember 55 pages also. So what is this? That as I told you, that RCOG has compiled its curriculum in a very nice way. So you will see here also there are a lot of good algorithms and tables given. So please, as I told you, take printouts or take like save these algorithms and keep remembering, keep recalling, keep reading them again and again. These are all like, pictorial memories, make pictorial memories of these tables, and they will help you in solving your MCQs in a very, very efficient way. You will easily come to know, okay, after this step, the next step would be this, because the MCQs, how they come is that, they are not very plain. Some of the, when you attempt the part 2 exam, you will feel that some MCQs were very direct, they were very simple facts, and you just have to choose one. But most of the MCQs are actually very technical and very smartly made up. How will they write that? They will write the first steps or second step of a algorithm, and they will ask you what will be the next step you will do. So if you don't know the algorithms and you don't know the steps, you will forget it, you will not be able to choose the right answer. And another thing is that some modules, they make very plain MCQs from them, but in some modules, for example, infections and similarly the subfertility, they make very technical questions. So you have to pay a lot of attention to them. For example, they're making the um an MCQ from the chickenpox guideline. They will not ask you that what is the treatment of chickenpox in pregnancy, what is the incubation period of the chickenpox. They will not ask them in like simple like this. They will ask you that a patient presented at this week of gestation and she had previous exposure of chickenpox in last 1 day, and now she is presenting to you, and she's unaware of her vaccination, and she did her blood test and this was the result. Now what is the chances of risk to the fetus? Or like it will be like a multi-layered question. It will not be a simple straightforward question, and sometimes they will not even tell you the disease. For example, they will ask you a question about uh, they will put a question like this, that a sex worker come to you and she complains of vaginal discharge, and she is also pregnant and she has rash on her body, and you did some test and the VDRL was positive and THPA was positive. So what will you recommend her? What will be your management plan? What will be your next step in the management? So in that case, you have to think that, okay, the rash might be of syphilis. This is the test is positive, the test is negative, the test is inconclusive, and then you have to dig out the management. So this is why I'm saying that these modules, the infections and the fertility, and these similarly the modules with the labor and delivery, they're very technical. So you have to pay a lot of attention to them and make your concepts clear about them. And if you are a resident aiming to give this exam, or somebody who's new in specialty, then you want to clear your concepts, then please remember that these guidelines are only guidelines for the clinicians. They don't tell you the pathogenesis behind this. So if you want to if you want to clear your concepts, for example, what is the pathogenesis of preeclampsia or what is the pathogenesis of SGA, then you have to go and consult your books. For pathogenesis, these guidelines are not good. These are only for clinicians who are actually sitting in their clinics and practicing and managing. So you you should know this difference also. And it will be very beneficial if you have a study partner. That will be very helpful. And I would highly recommend that please make your own notes, because this subscription with the websites, they are for limited time, and you have to go back to your guidelines, your notes, till you pass your past part 3, and even after that. So you should have something in hand which will stay with you, and you can have easily access to it forever. Not just like, if you have subscription, that subscription will be for a certain time. So that's what I want to share. And I wish you all the best, and I hope that we are able to help you, and we wish you a smooth sailing through this exam. Thank you.
Thank you, Dr. Zaveria, for sharing your tips and tricks and guidelines on how to read and understand these summaries. If you all have any questions, please type it in the chat box so that we can answer and address them. For any doubts and any queries regarding the courses and the sessions, please contact Minhal or Dr. Sadhya, and they'll be able to help you out with any queries or doubts that you all have. There's a question by Dr. Fizam. Ma'am, kindly guide how to prepare for EMQs and the pattern of paper. As we mentioned at the pattern of paper, we have 40% are SBAs and 60% are EMQs. How to tackle EMQs, we will start teaching all in the live lecture, so don't worry about that. How many reads should be there for guideline? At least twice would be enough. Again, depends on how confident you are with that guideline. Some guidelines are easy to remember. You can do it in one go. But I would say that a complete revision once at least is needed for all guidelines. So 2 reads minimum. If you'll have more time, you can go for the third read as well.
Dr. Madhura, please, can I add one more thing I forgot?
Yeah, sure, ma'am.
Yeah, thank you. And another important thing is that, once you're preparing for part 2, please remember that there are certain things which are concept based, and in those things you have to clear your concepts. And there are certain things which are actually factual. They are simple, like, digits and simple numbers, and you have to remember them and cram them. So, and especially, when you're giving the exams and you're reading the consent advices and you're reading the incidences, every candidate is concerned that how we remember them. Every time I start forgetting them, I keep forgetting them. So what is, like, the easy way? And it's actually a very challenging thing, because somebody like, us, who is more focused on making concepts, when they have to remember the digits and number, it becomes difficult for them. So what I can suggest is that whatever guidelines you're reading, please make a separate, like, either notebook or either, like, a folder in which you start you keep writing your incidences. For example, the incidence of shoulder dystocia, or incidence of gestational trophoblastoma diseases, or anything like this. Okay, so please keep writing them and keep going through them again and again. Whenever you are getting time, you are going to like, you are uh, whenever you're free in your clinics or in your home, at whatever time you're available, just go through them, and it will just stick with your mind. And similarly, keep, like, discussing with your study partner or with any colleague that, okay, I've read this thing, the shoulder incidence is this, shoulder dystocia incidence is this, the incidence of fertility in couple is this, and like this. So this is an important thing, because incidents, these are very easy questions, and they give you, like, full marks, but the only thing you have to do is that you have to remember them. And actually, when you are in going for part 3 and you're counseling your patients, these incidents will also, you have to code them in the counseling for the patients also. So you have to actually remember them. So this is one thing I also wanted to share. Thank you.
Thank you, Dr. Saveria. This is another important point that I told you all, that single best answers do ask incidences and prevalences. So whenever you're reading, whenever you're revising, make your own notes, make a table, or as ma'am said, either in your iPad or a notebook, And we don't worry, we will also be giving you flashcards, and while the live lectures, the mentors will highlight these incidences and prevalences, so it is easy for you all to add it to your notes. But this is something that has to be at least you'll have to keep on looking at these numbers again and again, because they are volatile. So again, put it up on your room, in your room, or save it in your folder, save it in your your phone or your iPad or wherever you're reading it, and you can easily just look at it again and again. We have to prepare more for EMQ. Dr. Bhavna, we have to practice more EMQs. That is right, because so that is what I'm trying to tell you. There is no set portion that this is going to be asked in EMQ or this is going to be asked in SBS. Once you understand your content properly, the guideline properly, you will be able to solve the extended match questions as well. So application of the guideline in the extended match questions is important, and the more you practice the EMQs, the more easy it is for you to understand and solve them as well. So yes, maybe we will have to pay attention to EMQs a little more, because it's a different format of MCQ which we have not solved in the past. SBAs is something that we have solved in the past, thus making easier for us to solve the SBAs, a little more difficult to solve the EMQs. So yes, we will pay more attention in preparing you all for EMQs as well. Any more questions, guys? Thank you. If there are no, if you'll have any further questions, you can contact any of us and let us know about what doubts you'll have. And I hope today's session helped you all, get a little more acclimatized to this exam and how you have to prepare for it. I'd like to thank the team and Dr. Zaveria to give the valuable time and expertise so that we can learn better. Um Thank you. Thank you, Dr. Aisha. It was a really nice opportunity to communicate with all of you all. I hope we'll see you on this journey further ahead for preparing for part 2 together. Okay. Thank you. Good night.
Thank you, Dr. Mathura. Good night.
Thank you, Dr. Zaveria. Good night.